Hi, in this video we'd like to go through the list of examinations that you need to get checked with here at the hospital for a potential diagnosis of your miscarriage condition. So here at the hospital we specialize in the treatment and diagnosis. So our diagnosis is very systemic and very thorough. If you do have an underlying cause for your miscarriage, regardless of how many it has happened over the years, here at the hospital we can definitely diagnose it with our multiple examinations and then give you the appropriate treatment. Now, in our years of experience in the field of miscarriage treatment, we have tabulated that there's over 43 to 44 individual causes for miscarriage. So our diagnostics and examinations will definitely individualize your cause and then give you the appropriate treatment. So there are 7 examinations here that you need to do. 7 very important. You are not allowed to skip any one. So the first examination that we will need to do is a blood test for anti-embryonic antibodies. And this is our patented diagnostics and treatment. And anti-embryonic antibodies are the cause for recurrent immunological miscarriage, the primary cause. And you cannot find this diagnostic test anywhere else besides here at the hospital because the patented rights and discovery belong to our hospital. Now, if you do have repeated miscarriages very likely caused by this antibody, and you have a specific level, for example, is very high, then we will give you our patented immunotherapy, and then this antibody will be neutralized and you will be guaranteed to have a very successful pregnancy. Second test that we want you to do is a HSG test, which is a Hysterosalpingograph. It can let us know the shape and size of your uterus, which is also a very common cause for early miscarriage. We can diagnose septate, diadelphys, biconduit, uniconduit, rudimentary, all forms of malformation. It can even tell us whether your fallopian tube is blocked or other things as well. So it is a very important imaging test that you cannot skip. The third one is a endocrine examination. So endocrine examination means we need to do a hormonal profile. Are your hormones functioning correctly? Are they at a healthy level? We might need to do an MRI as well to check for your hypothalamic function. Make sure all hormones are at an appropriate normal level, and then only you can be recommended for pregnancy. If there is a deficiency, we either might need to supplement or treat the underlying cause. The next one is a colposcopy. Colposcopy will let us diagnose problems with the vagina or the cervix, and it's a very quick and painless diagnostic, so you don't have to worry as well. Then the next one is a 4D color Doppler ultrasound. Now, 4D color Doppler ultrasound, the benefits is that it gives us very crisp, high definition colored image. Now we can look at the vagina and also parts of the cervix, and it let us identify if there's any presence of growths, tumors, cysts that might affect the pregnancy. And then the last 2 tests is a genetic screening. Genetic screening means we need to do a karyotyping for your genes and your partner's genes to figure out if there's any rare deformity causing or lethal abnormalities of the chromosome. Genetic cause for recurrent miscarriage stands about less than 5%, so it's unlikely that you do have this cause, but then we still need to do this test. The final one is a cervical dilation examination. This is very important because it helps us prevent you from having a late miscarriage. It can prevent all the previous tests prevent an early miscarriage within the first 12 weeks, but the final test, which is a cervical dilation examination, lets us preserve your pregnancy all the way past the 2nd and 3rd trimester because it can test for short cervix and cervical insufficiency. And if you do have them, we can have them treated. Now, if you complete all 7, there's a very high chance that you can have a successful full-term pregnancy. You can begin your family. So share this video for those who are interested in coming to Antai Hospital, and also for those who have repeated miscarriage with no solution. No doctor can help you. Here at the hospital, we can definitely help you, and we offer you a full refund guarantee as well. So you give us a signature with an agreement between patient and hospital. If you do experience a pregnancy failure, then we will offer you a full refund. Get in touch via the website above and also leave me a comment down.